Executive Vice President for 1199 New England, and I'm the Area Director for Rhode Island, and we're here today to roll out our report that we've done. We've named it Front Lines to Bottom Lines. We know that there's been a lot of discussion and debate and brainstorming about how to improve the Medicaid system, and we want to ensure that the voice of the people who actually do the work, provide care to our residents and frail elderly, that gets brought into the mix. And so we have a set of policy recommendations, and we want to bring those out to you all today, but we also have a few people that are going to add their voice to it as well. And some of them helped us put this together, and some of them are just here to endorse it, and some of them are just add some context. So this is Nicole Ward from Greenville House Center in Greenville. Linda, who's one of our staff, who is the old. Sarah Nolan, who's a researcher with SEIU and helped us provide some context about what's going on in other states. And Jen Steinfeld is from the Women's Fund. And Dawn O'Clair is from Hopkins, and she's a Central Falls resident. So we have a press packet here if anybody needs it. What I'd like to start out doing is just by making a couple of opening comments. And the first one is, as I was just covering, the question really for us is not how much money we're spending, but to continue to ensure that we have quality outcomes in nursing homes. What are we spending money on? What are we spending too much money on? And what should we be spending more money on? So there's a number of policy recommendations in the report. One thing that we want to highlight is that most direct care staff don't make a living wage. And this is work that's important, it's vital, it's something that people want to do, but they still need to earn a living wage to live in Rhode Island. And I think most of our elected officials, most of our residents would understand that when we pay for Medicaid services, we want to make sure that as much as possible makes it to the bedside, improves outcomes for residents, and improves outcomes for their family. Also, we want to rebuild some oversight, which we believe has been lost. These are very complex organizations, and there's a lot of money flowing, so we should be able to say to taxpayers and to other funders, well, here's where the money went. So we want to rebuild some of the oversight that we believe has been chipped away at. And we want to continue to emphasize quality, and we know one of the quality measurements is what is the staff turnover ratio. If there's a lot of turnover and a lot of academic studies and a lot of research that documents that when there's high turnover, there's more problems, there's more falls, there's more decubitus, there's more issues related to patient care. So we're going to touch on that as well. And then also, we were encouraged to think outside the box as part of this whole Medicaid initiative. And one of the things that became clear in talking to our members and looking into this is that it's really a traumatic time for families when they have to figure out whether their family member should be in a nursing home, or whether they would be fine in assisted living, or maybe it's just putting together the pieces to make it all work through home care, etc. But one of the things that we think that would really support families in doing that and not be rushed into a decision because they already missed a couple of days of work, a couple of weeks of work, is an extension of the TCI program. For people that have been through this, it's traumatic. It's very gut-wrenching for families to put their loved one in a nursing home. They usually do it after exhausting all the possibilities and being out of work. So an extension of the TCI program to even by just an additional 2 weeks would really help families find and identify the right placement rather than just have to do something in a hurry so that they have something in place for Monday when they have to go back to work. So those are the broad outline, and then I'm going to turn it over for a few minutes to Nicole, who's a CNA at Greenville. So thanks, Nicole. Thanks for being here.
Yeah. Hi, my name is Nicole Ward, and I've been a CNA for about 3 years now at Greenville Skilled Nursing Center. Every day, we get the residents up and dressed, everyday routine. Most people don't believe it's more than getting dressed, but it involves a lot more details. We have to two kids. I have a 7- and 9-year-old girls, and with $13 an hour, it just feels like it's not enough to balance pay by pay. We have bills every day, and some bills we have to push back, and by pushing them back, we have fees. And it just feels as though we're not getting the pay we deserve for the care that we're giving. Our residents want quality care, and we want more. We want to provide for them the care that they deserve, but also to be able to take care of our families the way that they deserve. I'm hoping that the state will do what is right and look over the Medicaid and trying to figure out what they can do for nursing homes. Because us CNAs, we want to stay in this field. We like our job. We love our residents, and we just want to make sure we can provide for our families as well.
Thanks. So, for those of you that have the report, I just would direct your attention, which is it's actually up on our screen, it's on page 4, and that shows that in both key caregiver categories of certified nursing assistants and personal care aides for people that work from home, we're behind our neighboring states, Connecticut and Massachusetts. Our rate is $13.65 for CNAs in the institutional setting, and for folks in Connecticut and Mass, it's $15.36 and $14.50 respectively. So we're spending almost as much, but it's not making it to the direct care staff, and that's one thing that we think that ought to happen as part of this budget and set us on a path. Because sustainability is not just sustainability for the state budget; it's sustainability for the people that do the work. So next, I'd like to introduce Jen Steinfeld, who's from the Women's Fund. Jen, thank you for being here.
Thank you. As Patrick said, I'm Jen Steinfeld. I'm the Executive Director of the Women's Fund of Rhode Island, and we work to invest in women and girls in our state through research, policy advocacy, and leadership development for women. For us, we're here because this is a social justice and a gender equity issue. And we've all heard the governor talking about the need for more middle-class jobs and more pathways out of poverty for people. And hardworking Rhode Islanders should be able to count on a living wage when they're working with our most vulnerable people, our senior citizens and our elderly. This is a gender issue on two fronts. Women live longer than men. Nationally, women are 75% of Medicaid-funded nursing home residents. And in 2009, which is the last year that this data was publicly available, women represented 74% of Medicaid nursing home residents here in Rhode Island, and women were 83% of the Medicaid beds of people over age 85, so those tend to be the very high utilizers. We need a lot of support and a lot of care. And the women are overwhelmingly represented in the workforce as well. The Bureau of Labor Statistics estimates that 90% of direct care workers in healthcare settings are female. So for us, this is very much a justice and a gender equity issue. We support strongly women's economic security, and this is an important issue for both patients and for workers. We're really glad to be here to be elevating the conversation to make sure that the workers are part of the conversation and not just the institutions. So we recognize that there's an overrepresentation of minority women in both residents and the workforce. It's additionally a racial justice issue. And we were really proud to work with SEIU to pass the temporary caregiver insurance bill. We think it's a really remarkable piece of legislation. It's put Rhode Island on the vanguard of a national movement on more paid leave. Rhode Island is just the third state to have this type of legislation. It allows families to take care of one another rather than going into a more expensive and more burdensome for the family and for the resident an institutional setting when it's not necessary. We're really happy to see this program being put forward as a cost-saving measure as well in all of the conversation about Medicaid. It's something that we think is a smart solution that helps meet everyone's needs, the budgetary needs, the family needs, and the institutions, the nursing homes and hospital staffing needs. So we are proud to collaborate with 1199 on smart solutions that help support us all, on good wages for direct care workers, on high quality care that's focused on health outcomes and patient need, and increased increased home care options and workplace to be here today, hearing from these workers on how much commitment they have. And I think they deserve to be rewarded for that work. Thank you.
I just want to take a minute. Dawn is a long-term worker at Hopkins in North Providence, and she's a UCF. And I just want to ask her to come up and share a few words. Thank you.
Hello, my name is Dawn O'Clair. I'm from Central Rhode Island. I've been employed at Hopkins for the last 15 years as a CNA. My job, I love my residents. They love me. They depend on me. I enjoy taking care of them. You grow bonds with them. They eventually pass away, which is heartbreaking. If these deep cuts go through, it's going to end up leading to a reduction of hours and a layoff. I'm a single mother of 5 with 3 minor children. If something like this was to occur, I would end up having to go to unemployment and to other state funding as far as SNAP and right care. Now that the funding picture is better for the state, I hope funding will be restored in a way that helps the frontline staff members. Thank you.
So that actually, I just wanted to emphasize that one of our recommendations, one of our recommendations is that there be a restoration of the funding. The initial budget placeholder from the governor's office talked about unspecified cuts. Fortunately, the revenue picture has improved. The utilization numbers were somewhat overestimated. So we know that there is some ability to restore some of this, but we're not for an across-the-board restoration. We really believe strongly that whatever is restored should be subject to a clawback so that people don't use that to improve the wages, hours, benefits, or the number, staffing levels of nursing homes, direct care staff, then the state ought to take it back. And there's a precedent for that. We did that in 2001. We were in a little bit of a different circumstances because we, despite a really good economy, and maybe because of a really good economy, we didn't have enough direct care staff in nursing homes. So the union and the industry, prevailed upon the General Assembly to put more money in, but only if it was used for the stated purpose, which was to improve wages and benefits. And that actually made it into the 2001 budget article, and for the most part, it was quite successful. It was DHS at the time went in and audited people after 6 months, 12 months to see that they actually returned the increased payments and spent them through direct care. So that's one policy tool that we think that the General Assembly should reach back into the toolbox and pull out. One other, what I would call blast from the past recommendations is in 2008, 2009, it was Representative Siegel at the time, put in legislation which ultimately was in the budget to take a look at energy savings in all areas of Medicaid spending. We're a leader in terms of energy conservation as a state, and we should build on that strength, and we should ask vendors who are either completely funded by Medicaid or significantly funded by Medicaid to take a look at what they're doing in terms of their energy consumption and see what they can do to reduce it. That will take those savings out of the budget in years to come. It may not be big dollars, but over time, it brings more money back to direct patient care. I would look to Article 24, which the governor and the General Assembly, the General Treasurer, has put forward that talks about building an infrastructure bank. It may not be the same set of solutions, but we can build upon that initiative and identify best practices so that individual employer institutions can figure out ways to reduce need for hot water, electricity. Some of these places have electric heat, believe it or not. So we have a long way to go there, and that's really is low-hanging fruit. So with that said, I'm going to ask Nisha to come up.
Yes.
How are you? Thanks for being here.
Hello, my name is Manushka, and I work for Genesis. And today I'm really happy to talk for myself and for all my friends. They couldn't make it because they can't afford to do so they got work because of the money. We love what we're doing, we love our residents, and being a CNA, it's really humble. That's a job. You take care of people that you don't know, but you come to love them. And you want to give them the best. But sometimes, what you make at work, and the work that you have, you can't really concentrate on it. And we want to give the best every day. And we want to take some days off because we can afford it. So, everybody will come. They all wanted to come, but they can't. So that's why I came. And I just want to say that, we want the CNAs to be happy. Because once you're happy, you do better work, better performance. So that's what I want to say. Thank you.
Thank you very much. And then just jumping back to the front line to bottom line report, I just wanted to highlight a couple of things. And we were fortunate to have a network of folks through our national union. SEIU is just a little bit over 2 million members throughout the country, and a lot of those people work in healthcare, more than half of them work in healthcare. So we have a wide network of folks that we can tap into to see what has happened in other states. And I just wanted to give Sarah Nolan, who works for our national union, a couple of minutes to talk about what's been going on in other states and what information we pulled together and tried to learn from for what the other states have done to control costs, but also to improve quality outcomes and to improve wages. So, Sarah, thank you.
As Patrick said, I'm Sarah Nolan. I work for SEIU in Washington, although I actually live just north of here in Massachusetts, where I worked on health reform. And I would say that although the report we're releasing today appropriately focuses on solutions to what's essentially what we're calling, I think, the shorter term set of issues that partly drives the working group, there's also longer term game here. So a lot of policy discussion, the sort of instructions to the Medicaid working group were to also consider longer term reforms to the system. So in the, I guess the Rhode Island did its big global waiver in 2009, and in the last 6 or so years, there's been a real move in states towards what I would call sort of broader system reform in the Medicaid context, and actually often going beyond the Medicaid context, but where a state has the greatest sort of set of levers to influence it is in the Medicaid sphere, and often in the context of an 1115 waiver. So SEIU has worked pretty closely in Oregon, Massachusetts, and California, New York, a number of states. So in the report we outline, and I wouldn't say we're saying Rhode Island should adopt any of these models wholesale. The point is that there's a lot of work going on around the country on system delivery reform, payment reform, and that the working group and the sort of policy conversation in general in Rhode Island should look to some of that work. And I would say what sort of characterizes, there are different models in each of the states that we talk about, but what characterizes all of it is a move towards more integrated and coordinated care, essentially states committing to some risk for not meeting spending targets, which can be a little bit scary, but the sort of trade-off is that you potentially get extra federal money that helps you invest in some of the actual activities that will promote savings down the line. And the point that we've made over and over again in these conversations in other states is that frontline workers really need to play a role in these broader system reforms. So as I said, we outlined some of them in a very basic way in the report and encourage the policymakers in Rhode Island to look more closely at some of these models.
Great, thank you. So just to wrap up, our policy brief that we put together today from Frontlines to Bottom Line is a series of initiatives. We're not in favor of just restoring the rate cuts that were proposed. They haven't obviously been implemented yet. We believe we should have targeted restoration that should be based on trying to drive quality, that should be based on trying to figure out how to reward those who have good staff retention records, We know that that improves quality outcomes in nursing homes. We need to get back some of the transparency that we've lost. Borrowing from another state, Connecticut has passed legislation that requires reporting of all payments to related entities, related companies. That's a good place to start. There's a lot of different content here. Some of it will be easy to implement, some of it will take time, but we do need to invest in the Medicaid system to effectuate the change. And the way to do that is to stop spending too much money on things like rental and too little money on direct care staff wages, be it home care workers, be it nursing home workers. We're not going to be able to grow an alternative to home care, to nursing home through home care if we continue to pay those people nothing. And many people want to do that work, but they can't do that work because you're basically asking them to sacrifice their economic well-being to do it. So we have to do this in a smart way, we have to do it in a comprehensive way, and we have to do it in a way that begins to change our capacity, and we grow capacity in areas like assisted living, respite care, home care, etc. We know we have some unique characteristics, like we're the leader in the nation over 85. We need to recognize that we can't take resources from the neediest people and spend them in a different way. We need to bridge, as the Senate President said, this whole problem and take that money and use it to move our system in the right direction and rewarding people that do the frontline work. So thank you for coming, and I'm happy to take any questions, or any of our folks who want to try to answer some questions. Fire away. Thank you.
What was that reference you just made a few moments ago to rent?
Fair rental value is a complex formula, which is on page, a second, Rich. It starts on page 9. So there's a lot of different transactions that happen where one entity owns the nursing home and another entity operates the nursing home, but they're really related entities. So the nursing home is showing no profit because it's paying significantly higher than market rent to the entity that owns it. So some of these are called real estate investment trusts. But essentially what we could take the initial step on doing is, we know that we're sort of an outlier. A lot of states, I think it's Virginia, it's listed here, let's see if I can find it. Virginia has reduced it. We're paying a fair rental value rate that exceeds California on the whole, with some very few exceptions. Real estate in California is usually worth more than real estate in Rhode Island. So we should take a look at that as a way to bring that money back to producing quality outcomes. So it starts on page 9 and then goes over to page 11. And then in that bundle of sort of related transactions, we should have more transparency. We should look at what we're paying for home office costs. One of our largest operators has like 1,000 beds, doesn't have any office in Rhode Island. So all those transactions happen somewhere else. And we've actually dismantled, we had a cost-based system, we went to a price-based system, now we're doing this managed Medicaid thing. We have a lot less information about where the money is actually going. So we want to rebuild some of that so the state can make wise policy decisions and not be dependent either on the industry exclusively or on third-party vendors like Hewlett Packard and other folks. I don't know if that directly answers your question, but those are payments for the capital costs, which we believe are outside the norm. Anything else? Anybody else want? What's that?
Would you ask if you want to say anything?
Yeah.
Sorry, I didn't get a chance to say earlier that one of the residents that I deal with, he's combative, and when residents are combative, it's really hard to care for them. So you need to be patient and lenient with them. A lot of the family members know this, and that's why they have their family in the nursing home. So me, myself, I take my time, being a mother with 2 kids, I've learned, certain ways to deal with kids, including residents. And the family loves me for that because they see how much effort I'm But in nursing homes, you don't have that much staff members to actually have that one-on-one commitment with the resident. I believe if we have a lot of one-on-one, there will be a lot more better income. How do you say this? A lot more of a effort in the CNAs, because when you're running around trying to take care of all these residents, sometimes they feel that tension from you. Even though you're not showing it, they can feel it. And we really want to give the residents all of our time and our efforts that we possibly can. And a lot of times, like one of the CNAs said, we have a lot of things on our mind. We have a lot of bills we have to pay, and coming into work trying to do the best we can, it can be stressful for us, especially when you're working the first shift too. So I just wanted to put that little 2 cents in, and thank you.
Thank you. All right, unless there's any other questions from folks, we're done, and we're going to be going upstairs to the House Senate Ward and talk to some of our representatives, both from where we live and where our facility is located, to let them know what our concerns are and what our recommendations are to improve. So that'll be happening in about 5 minutes, until 4:35 o'clock. Thank you.